Anatomy of the frontal recess. The frontal sinus is arguably the most complex of the paranasal sinus. The frontal sinus ostium drains into an hourglass-shaped space termed the frontal recess. The frontal recess is a three-dimensional space which communicates with the ethmoid infundibulum within the middle meatus. The ventilation and drainage of both the maxillary and the frontal sinus pass through narrow complex clefts and spaces before they reach the middle meatus. So these clefts and spaces are a part of the anterior ethmoid air cells. So a normal healthy frontal sinus is therefore dependent on the health of the anterior ethmoids. The frontal recess is bounded anteriorly by the agger. You can see the agger cell here, and the frontal process of the maxilla, which forms the frontal beak. The thickness of the frontal beak depends on the pneumatization of the agger and the presence of the frontoethmoidal cells. Here in this diagram, we can see there is a large agger. So if there is a large agger cell, then the frontal beak will be small and the frontal ostium will be wide. Here, if the agarnesis cell is under-pneumatized, then the frontal beak will extend significantly into the frontal recess and create a narrow frontal sinus ostium. The medial wall of the frontal recess is formed by the medial wall of the frontal recess is formed by the lateral wall of the olfactory fossa, known as the lateral lamellae of the cribriform plate. The height of this wall is determined by the level of the cribriform plate. We know the Keros classification, which classifies the depth of the olfactory fossa as Keros type 1, that is less than 3 mm, type 2, 3 to 7 mm, and type 3, more than 7 mm. So depending on the Keros types, a variable amount of the lateral wall of the olfactory fossa will be exposed during dissection in this region. And here the bone of the lateral wall of the olfactory fossa varies in thickness between 0.05 to 0.2 millimeter and provides very little resistance to penetration. The, la, the lamina papyracea forms the lateral wall, and posteriorly the bulla forms the posterior boundary of the frontal recess. Here the bulla lamella, we can see the bulla lamella is absent superiorly. Here the bulla lamella is present. In this diagram, the bulla lamella is absent superiorly. In this case, there will be a suprabullar space that will communicate directly with the frontal recess. And in this situation, the anterior ethmoid artery is not protected by the bulla lamella and may be at risk during dissection of the frontal recess. So this crescent-shaped uncinate process attaches inferiorly to the inferior turbinate, but superiorly it can attach to the lamina papyracea in 33% of the cases. It can get attached to the skull base in 10% of the cases, or it can get attached to the middle turbinate, or a combination of all these three in 57% of the cases. Now the simplest configuration is within the frontal recess is the presence of an agger cell only. A presence of agger cell only is the simplest configuration. Now the array of cells, there are many accessory cells in the frontal recess. These accessory cells can be very complex and confusing. Earlier, Bent and Kuhn proposed a classification. Recently, a more simplified classification has been proposed by the International Frontal Sinus Academy Classification. It primarily describes these accessory cells based on their location and relationship with the agarnesia and ethmoid bulla. So this is the classification. So the simplistic configuration is presence of an agarnesia cell only. Then the classification of the anterior group of cells. Let me describe. Let me try to describe this. This as I told earlier, the simplest configuration is the presence of an agarnesia cell only. So this is anterior and this is posterior. So any cell above agarnesia is called supra-agar cells. Similarly, cells above the bulla are called supra-bullar cells. Now, the supra-agar cells are again divided into 4 types. If there is a single cell above the agarnesia, that's called a supra-agar cell, type 1 supra-agar cell. If there are multiple cells above the agarnesia, but they are not communicating with the frontal sinus, we call it as type 2 supra-agar cells. If there is a supra-agar cell that is communicating with the frontal sinus, we call it as a type 3 cell, and when it communicates with the frontal sinus, it's called a supra-agar frontal cell. Supra-agar frontal cell. It's a supra-agar cell will not communicate with the frontal sinus. If it communicates with the frontal sinus, we call it as a supra-agar frontal cell. And supra-agar frontal cell, if the pneumatization extends beyond 50% of the frontal sinus, we call it as a type 4 supra-agar frontal cell. So again, so this is say type 1 supra-agar cell, that is a presence of a single cell above the agarnesia. So supra-agar cell, type 1 supra-agar cell, a single cell above the agarnesia. It's a type 2 supra-agar cell, that is here it is multiple cells above the agarnesia but not entering the frontal sinus. This is a type 3 supra-agar frontal cell, that is it communicates with the frontal sinus, but it will not enter up to the less than 50% of the frontal sinus. But in here it's called a type 4 supra-agar frontal cell, that is a cell extending beyond the 50% height of the frontal sinus. It's called type 4. So all these are anterior cells, type 1, type 2, type 3 and type 4. Type 1 supra-agar cell, type 2 supra-agar cell, type 3 supra-agar frontal cell, and type 4 supra-agar frontal cell. They are called frontal ethmoid cells. To tell us frontal ethmoid cell, it should arise from the anterior should be an anterior lateral ethmoid cell above the agarnesia and it should be in contact with the frontal process of the maxilla. Now, the significance of these cells are they push the drainage pathway posteriorly. Similarly, any cell above the bulla is called suprabullar cell. Any cell above the bulla is called suprabullar cell. Simply, if we tell you a suprabullar cell, it means that it's a cell above the bulla, but it is not communicating with the frontal sinus, similar to the supraagger cell. Now, if a suprabullar cell communicates with the frontal sinus, that's called suprabullar frontal cell. Suprabullar frontal cell. That is, it communicates with the frontal sinus. So this is a suprabullar frontal cell. Here we can see a type 3. This is a type 3 supraagger frontal cell, and this is a type 4 supraagger frontal cell. Now the significance of the suprabullar frontal cell is that they tend to push the frontal sinus drainage pathway anteriorly. Now the remaining things are, we have discussed the agarnaceae, the frontal ethmoid cells, then suprabullar and the suprabullar frontal cell. Now the remaining is the supraorbital ethmoid. Now what is supraorbital ethmoid cell? Here we can see a supraorbital ethmoid cell. This is the supraorbital ethmoid cell. So what's the supraorbital ethmoid cell? It's a posterior extension of the anterior ethmoid air cells into the orbital plate of the frontal bone. There are two clinical significance of supraorbital ethmoid cell. One is that it can be mistaken for a frontal sinus, and always the opening of the supraorbital ethmoid cell is more posteriorly and laterally compared to the frontal sinus. The second significance of the supraorbital ethmoid cell is its close association with the anterior ethmoid artery, especially with the anterior ethmoid artery in the mesentery. So in some cases, the anterior, this arrow shows the anterior ethmoid artery. In some cases, the artery may be exposed or suspended in mesentery in close relation with the supraorbital ethmoid cell. Now, finally, there is one more cell. There is a cell which arises medially. It's called an intersinus or frontal septal cell. That is a cell. It is pneumatized in the between the interfrontal sinus septum. So the significance of this cell is that it tends to push the drainage pathway laterally. So these are the classification